Hello, this is Marisol Lopez. Here I have my name. Today, December 5th, 2021 for Biology 240. And today I will be speaking of the structures of the respiratory system. I have already dissected my fetal pig, and then I'll be speaking of a common disease of the respiratory system. Okay, so let me get my gloves. All right. Then angle my camera. Let's see. Alrighty. Okay. So first off, let me go ahead and turn so we could get a better image. So I will start off here with the location of the larynx. Let me open. Here we have the larynx right here. And then the trachea follows. Okay. And right over here, anterior to the trachea is the thyroid gland. And right below, inferior bottom part of the trachea, we have on both sides the thymus glands. All right. And then we have the bronchial tree, or the trachea leads down to the lungs on both sides. And that is the right and the left primary bronchi that leads to left and the right side. Okay. Then we have the right and the left lungs. Let's see if we can angle it here. All right. So we'll start off with the right. Here on the top is the superior lobe of the right lung. Then right here in the middle is the middle lobe. And right down here, we have the inferior right lobe. Okay. And then on this side, the left side, we have only two lobes, which are the superior lobe and the inferior lobe of the left lung. And then right below the lungs, where the lungs rest, that would be the diaphragm. Okay. And wedged in the middle of the lungs on both sides is the hilus of the lungs. Okay. That's a little hard to see. Okay. And so we have a visceral and parietal pleura. So the visceral is the inner layer of the lungs, and the pleura, and the parietal pleura is the outer layer. Okay. So that is the structure of my respiratory system. All right. So now I will speak of a common respiratory disease. So the common respiratory disease that I have chosen to speak about is asthma. So asthma is, according to our textbook, is an inflammation of the bronchioles, the bronchial tree, and is usually triggered by an infection or an allergy reaction that affects the smooth muscle and the glands of the bronchioles. So what happens during an asthma attack is the bronchioles constrict and eventually could possibly close off entirely, making it really difficult to breathe for the person. And also the area gets closed off and blocked by mucus secretions, making it really difficult for the person to breathe. So normally in that case, a doctor would administer or prescribe inhalers, albuterol, or any type of blocker to open up the airways and open up the bronchioles. Okay, so that is all for my respiratory presentation. Once again, Marisol Lopez, December 5th, 2021. Thank you.